Hello everyone, happy evening, a very good evening. Am I audible and visible, everyone? Yes. Am I audible and visible, everyone? A very happy evening. I hope and I believe all of you are doing well. Amazing, Yashwant. That's superb. And yeah, so all these are the PYQs of the recent years of the FMG exams. And if you have watched the short classes in the Medsynapse app, you would know the tricks to almost all these questions, right? So if you have watched the short, you should actually get 10 on 10 on these tests. So very good, Yashwant, and everybody who's got 10 on 10. These are like the must-know topics for every exam. Okay, so what are we going to do? Quickly discuss this with all the tricks that help you in the exam also to recollect the facts and answer the question fast, right? Remember that to crack your exams, understanding the concept, reading the theory, that is just step one. But then comes the step of retention, right? Retaining whatever you are reading. And that is where the role of mnemonics and the tricks comes in. And then you have the third step, which is MCQ solving skills. Whatever you read, you need to know how to apply it to MCQs, right? So all these steps, basically, you have to tackle all these steps to get good scores and good ranks in your competitive exams like FMG, NEET PG, and AIIMS. Yes, Nirday, absolutely. So let's start discussing this question without any further delay. So the first question that we had was, which of the following biomedical waste is disposed in a yellow bag? So look at the option. You have blood bag, you have urine bag. So you know कि इसमें से कुछ answer है. What is the trick to remember that? Remember, blood is red color. Red color blood goes in yellow color bag. Okay. And urine is yellow colored. Urine ka color is yellow color. Yellow colored urine goes in red bag. Okay, so that is how we remember red in yellow and yellow in red. Where do the gloves go and where do the sharps go? What is the trick to remember that? Where do the gloves go and where do the sharps go? Right, remember gloves are made up of rubber, right? Recyclable, anything which is recyclable, R-E-R-E, recyclable goes into red. So gloves are red. Sharps, imagine like sharp teeth. How are the teeth? White in color. So sharps go in white container. Okay? So remember that red blood, red in yellow and yellow in red. That's how you remember basically the trick for this. Okay? So this is how you answer your first question here. Going on to the next question. Another very important story mnemonic of the GCS. Right? That story exactly helps you to answer the question of GCS very fast. What is the GCS of a patient with a head injury who opens her eyes in response to loud voice, localizes the pain, and is confused and disoriented? So you have been asked this question in terms of individual components, right? So for this, you should know this love story, the famous GCS love story mnemonic that we have, which is the story of a girl and a guy who are in love. They decide to meet, right? Go on a date and the girl gets ready. So what does she wear first is the shoes. Remember, at the score 2 is the shoe. And what does the shoe have? High heels ke sandals. Okay, remember high heels ke sandals. So the heels, which are basically like the extension. So remember, shoe is 2, that is extension. Then when the girl walks with pressure, right, putting the pressure on her heel wale sandals, that creates sound. Okay, that creates sound. So these are the three components at the score of 2, which is pressure, extension, and sound. So if you see here, at the score of 2, eye opening to pain, that is basically pressure. Eye opening to pressure. Another 2 is incomprehensible sound or speech. So that is sound is created. Another point 2 is extensor, that is decerebrate posture. EEE, decerebrate extensor. So extensor is 2. Similarly, at the score of 3, remember now comes under the tree. So where do they meet? Under the tree they meet. They have their conversation in code language so that nobody around understands that. So what are they having? They are having speech. So eye opening to speech, that is verbal command, is a score of 3, right? They are sitting in what position? Abnormal flexion, that is decorticate posture, is a score of 3, right? And they are having speech. So inappropriate response, words are discernible. So that is basically the words we can understand. Okay, so remember that at the score of 3, that is what you have. At the score of 4, their love grows more, right? And they are caught by the surrounding people. So they get confused. They come back to normal position, the normal flexion position. They get confused. So what do you have at the score of 4? Spontaneous eye opening. Spontaneously, they come back to normal flexion, right? They are confused. Now what to do? And spontaneously, they come back to normal flexion. They withdraw from abnormal flexion and they come back to normal flexion. So withdrawal is a score of 4. Then comes the score of 5. Remember 5, now that they are caught by everyone, their parents also know about their love story. So now the parents say, now you get married, right? So now they become the husband and the wife. After the marriage, all the pyar ka bhoot goes off, right? So the wife becomes oriented. And what does she keep doing? It is purposeful movement to painful stimulus. That's basically localizing. The wife localizes the husband. You know, kahan ho, kiske saath ho, ab tak aaye nahi. So localizing is 5. Then you have this oriented is 5. So the wife becomes oriented and localizes the husband. So that is what you have at 5. At 6, you only have M6. The wife says to the husband, obey my commands or I will beat you with the sticks. Okay, obey my commands or I'll beat you with the sticks. So now apply the story here. Eye opening in response to loud voice. That means in response to speech. Where were they having the speech? Under the tree. So this is a score of 3. So this is E3. Okay, this is E3, not E4. Option 3 is out. It could be 1, 2 or 4. Next is localizes. Who localizes the husband? Wife. Wife is what? Number 5. 5 is wife. So remember, localizing is M5. M5, not M6. So option 2 is also got. Then is confused. When do they get confused? At the score of 4, when their love grows more. So remember, it is V4 and not V5. And that is what the answer becomes here. E3, M5 and V4. Okay, that is how you remember this. Okay, that is how you remember this. So for anybody who did not know this story, this was for you guys to remember the GCS with this story, right? So this is E3, M5, M4. Remember, severe brain injury is a score less than equal to 8. Okay, that's a state of coma. Okay. Going to next question, the arterial blood gas findings are pH is this much, PCO2 50 and bicarbonate 28. Now, whenever you get acid-base disorder question, first is look at the pH. So, normal pH is how much? 7.4. Okay, normal values are all 4 containing. Normal PCO2 is 40, normal bicarbonate is 24. Bi starts with bi number, that is 2. So, 24. So here the pH is reduced, right? So that means it is acidosis or alkalosis. It is acidosis and not alkalosis, That is how you rule out the options, right? Next is PCO2 40 se zyada hai, bicarbonate 24 se zyada hai. So this is pH is reduced and the rest of the two are increased. So how is the change? pH reduced, PCO2 bicarbonate increased. So the change is going opposite. Remember the mnemonic Rome. In respiratory, it is opposite. In metabolic, it is equal. They go in the same direction. All 3 increased, all 3 decreased is a metabolic disorder. pH decreased, rest of the 2 increased. Opposite change is a respiratory disorder. So this is going to be respiratory acidosis, not metabolic acidosis. So this is what becomes the answer. In respiratory disorders, there is metabolic compensation. In metabolic disorders, there is respiratory compensation. Okay, so that is what you see here. When to apply the Winter's formula for metabolic acidosis, जो आप apply करते हो, you know, that is when you have to do that. When the values are changing, that means basically they are getting compensated. and that is why the values are changing. Uncompensated mein values change nahi hogi. So obviously you don't have to calculate the compensation here. If you see your exam questions, they do not ask you generally compensation ke questions. है ना, calculation वाले questions नहीं आते हैं generally. They ask you to identify the disorder. That is what is asked. Okay. Yeah. So this is respiratory acidosis with metabolic compensation. Next question, which of the following is not a component of Q-SOFA score? If you see, this has been asked in last year NEET PG exam also. So all the NEET PG students, take a note that you have to do FMG PYQs. FMG students, you have to do NEET PG PYQs. Okay, very, very important. Now remember that the Q-SOFA score ke component are similar to revised trauma score. And the trick to remember is RTS. RTS is the mnemonic for RTS or Q-SOFA. R for respiratory rate, T for trauma के patient में जो first score देखते हैं, कौन सा देखते हैं? GCS, and S for systolic blood pressure. Okay, S for systolic blood pressure. ठीक है? So remember that it has respiratory rate, it has altered mental status, that is GCS is affected, and systolic blood pressure. It does not have LDH. So what is not a component of Q-SOFA? LDH is not a component. Okay, LDH is not a component. Clear with everyone? Right, so remember revised trauma score is RTS, respiratory rate, trauma and systolic blood pressure. Both the scores have the same components that they have, Q-SOFA and also RTS. Next one, identify the type of inhibition shown in the graph. What is a very easy trick to identify this? Let's have a look at the three graphs. Okay, what you have to do is just look at the lines. The two lines, if they are crossing each other, अगर ये cross कर रहे हैं, so remember that crossing lines, C for C is competitive inhibition. If the two lines are parallel, like you see here, the two lines are parallel, so just make it a parallel line will become a U. So remember, this is uncompetitive inhibition. Uncompetitive is parallel lines. If the two lines are forming a V, right, so V is like this, उसको आप N बना सकते हो, उल्टा V, सीधा V, basically ये बन गया N, right, सीधा V, उल्टा V. So remember, V is a non-competitive inhibition, right? These are the tricks which actually become your savior in the exam. So look at the image now. What kind of image is this? It's a V which is formed here. Okay, so V, V, सीधा V, उल्टा V, this is going to be non-competitive inhibition. That is how you solve this question within seconds, right? So what kind of inhibition is this? It's a non-competitive inhibition. Okay, it is non-competitive inhibition. Remember, non-competitive. Okay, you can write like this. Non-competitive basically means no Km is increased. Km is not increased here. Okay, it is the Vmax which is changed. It is the Vmax which decreases here. The Vmax decreases and not the Km. Okay, and not the Km. Also, next time if you get a question that in the Lineweaver-Burke plot, what does the y-axis indicate and what does the x-axis indicate? So remember that Lineweaver is a double reciprocal plot. Okay, you have 1 by something, you have 1 by something. It is reciprocal. So it is double reciprocal plot. Remember, on the y-axis, it is y, v. On the x-axis, x is s, rhyming. X is s, 1 by substrate concentration. On the y-axis, vy, it is 1 by v. So 1 by v on the y-axis and 1 by s on the x-axis. That is what you have there. Okay, that is what you have there. Is this clear with everyone? Right, so very easy trick to identify the Lineweaver-Burke plot. Going to next question, which of the following parasites directly invade the skin? Right, they are directly invading through the skin. तो बाकी जो है उसमें आपको कहीं ना कहीं वेक्टर या कुछ दिखेगा, वो स्किन से नहीं जा रहा है. ड्रैकनक्यूलस, गिनी वर्म वाला, फाइलेरियासिस में वेक्टर है, ओंकोसर्का में वेक्टर है, ब्लैक फ्लाई, राइट? So remember, it is schistosoma which penetrates the skin, right? You can remember this as the term itself tells you. That is how you make a logical guess. Okay? Schisto, जैसे schizophrenia है, split personality. Similarly here, remember that schisto means like splitting. Soma means the skin. Okay, that's what you can remember. So it splits the skin and it goes inside. plus also this schistosoma has like a bifid as a tail. So remember split tail रहता है और skin को split करके ये अंदर जाता है. So remember schistosoma splits the skin and goes inside. Which of the parasites split the skin? In the nematodes. Nematodes which penetrate via skin. What is the mnemonic for that? We have learned in short. Remember it is sand. Okay, sand में जब walk करते हैं तब ये अंदर जाते हैं. So what is that? Strongyloids, stercoralis, ankylostoma and Nicator. Okay, Nicator, ankylostoma and strongyloids, that is basically the hookworm. Okay, you have hookworm, ankylostoma and Nicator. So sand, when you walk in the sand, these parasites, nematodes, go through the skin. Okay. Going to next one, a 42-year-old woman undergoes hip arthroplasty, started on dabigatran. How does this drug prevent thrombosis? Again, very easy trick. Dabigatran, remember tran, जो tran वाला drug है, TRAN, it's a direct thrombin antagonist. It's a direct thrombin antagonist. So basically, it is direct thrombin inhibition. Which are the other direct thrombin inhibitors? एक हमने देखा dabigatran, thrombin antagonist. दूसरा कौन सा होता है? Troban, यानी thrombin को बैन करने वाला. Example, argatroban. और कौन सा होता है? Remember direct inhibitors, din वाले are direct inhibitors like lepirudin, bivalirudin. ये direct inhibitors हैं. So these are the direct thrombin inhibitors. Heparin, they are indirect thrombin inhibitor. Okay, they are indirect thrombin inhibitor. The heparin is the one which acts via activating this antithrombin 3, and that is how it is indirectly inhibiting thrombin. Okay, clear with everyone? So remember the direct thrombin inhibitors are tran, troban and DINS. Tran, troban and DINS. Okay. Next one, which among the following are the yoke muscles of levodepression? Now, first of all, when you get a question on yoke muscle, remember it has to be exactly opposite. Right का yoke muscle left में होगा, superior का inferior होगा और rectus का oblique होगा. The exception here is like medial rectus will not have a lateral oblique. So the yoke muscle for medial rectus will be lateral rectus. For lateral rectus, it will be medial rectus. You do not have an oblique there. Okay. So if you look at the option right, left, right, left, right, left, right, right. So which is the first option that you rule out? Is the option 4, क्योंकि हमारा yoke muscle right और left होना चाहिए, same eye में नहीं होता है, ठीक है? They are helping in the conjugate movements. So एक right side का muscle, एक left side का muscle. So right and right option is out. Okay, so that's the first option you rule out. Now look at this one, superior, inferior, medial, medial, superior, inferior. So which option is ruled out? Option 3 is ruled out. क्योंकि medial का उल्टा lateral होना चाहिए. So this option is ruled out, this option is ruled out. We have directly ruled out 2 options. Now you have oblique rectus, oblique and oblique. So here also you see that oblique का यहाँ पे rectus नहीं हुआ, तो ये option भी rule out हो चुका है. So if you see, even without thinking about what action is the question asking, I have directly marked the answer by just ruling out the options and seeing that which option is ruled out. ठीक है? So that is how you solve the questions. Logically, you rule out the options. Right? This time you have options like this. Next time you might not have options like this. So you should know the concept behind this. For levodepression, ठीक है? For levodepression, मतलब left side में हम नीचे देख रहे हैं. So what muscles cause depression? Remember, rectus कौन सा होगा? Rectus मतलब straight muscle. जैसा उनका नाम है वैसा उनका काम है. Inferior rectus will cause depression. So opposite of that, what causes depression? It is superior oblique. So left side में inferior rectus, right side का superior oblique will what will cause levodepression. Okay, that will cause levodepression. अगर dextro वाला होगा तो right का inferior rectus और left का superior oblique आएगा. ठीक है? So remember that yoke muscle में सब कुछ opposite जाना चाहिए. Okay, right, left, superior, inferior and rectus का उल्टा oblique. Okay, rectus का उल्टा oblique. Levodepression खुशी means like imagine I'm trying to see here on the left side and downwards, right? So ये आई नीचे देख रहा है और ये आई भी नीचे देख रहा है, conjugate movement. तो जिस साइड पे हम नीचे देख रहे हैं वो साइड का रेक्टस मसल होगा, ठीक है? अगर लेफ्ट साइड में देख रहे हैं तो लेफ्ट इंफीरियर रेक्टस, राइट साइड में देख रहे हैं तो राइट इंफीरियर रेक्टस. ओके, क्लियर विथ एवरीवन? गॉट द कॉन्सेप्ट हियर? These tricks actually help you to score more, trust me guys, right? I've been there, done that, so I know about it. Going to next one, a female patient presented with 4 by 3 centimeter lump on the breast and on examination, pudgy-orang appearance is noted. What is the tumor staging? The T staging. Now remember that the pudgy-orang, the orange peel jaisa appearance, which is because of the subdermal lymphatic obstruction, it's basically the involvement of the skin by the breast cancer. So in T4, okay, in T4, remember that the tumor size is not important. Okay, the tumor size is not important. It can be any size tumor, 1 centimeter, 2 centimeter, 3 centimeter, कोई भी size का. It is T4A, B, C and D. A मतलब tumor अंदर जा रहा है, ठीक है? अंदर मतलब chest wall. B मतलब ट्यूमर कहां आ रहा है? बाहर आ रहा है, मतलब स्किन को इन्वॉल्व कर रहा है. सो B इज बाहर स्किन. C मतलब कंबाइंड, यानी A एंड B टुगेदर, कि बाहर भी जा रहा है अंदर भी जा रहा है, दैट इज C. एंड D मतलब डेंजरस, विच हैज अ बैड प्रोग्नोसिस, दैट इज inflammatory cancer. So D is dangerous inflammatory cancer. So remember in T4B there is ulceration, ipsilateral satellite skin nodules or skin edema, that is pudgy-orang appearance. So when you talk about pudgy-orang, remember it is the skin involvement, मतलब बाहर आ रहा है ट्यूमर, मतलब ये होगा T4B. Okay, this is going to be T4B. Is this clear with everyone? Do not look at the size for T4 staging. It is any size tumor. Okay, it is any size tumor. Okay, right. Going to next one, the last question here. A female undergoes a methylene blue 3 swab test and the middle swab is stained blue. What is the likely diagnosis? So very easy. In the 3 swab test, you have the methylene blue here in the bladder, right? There is vagina here. So 3 swab में basically जो हो रहा है 3 swab में सबसे ऊपर bladder के ऊपर आएगा ureter, फिर आएगा ब्लैडर और फिर नीचे आएगा यहां पे यूरेथ्रा. ओके, दैट्स गोइंग टू बी यूरेथ्रा. सो अपर स्वैब अफेक्ट हुआ तो यूरेटरो वजाइनल फिस्टुला, मिडिल स्वैब अफेक्ट हुआ तो वसाइको वजाइनल फिस्टुला और लोअर स्वैब अफेक्ट हुआ तो यूरेथ्रो वजाइनल फिस्टुला. द ओनली थिंग हियर इज यू हैव द ब्लू डाई इन द ब्लैडर, राइट? सो इन वसाइको वजाइनल फिस्टुला, इन यूरेथ्रो वजाइनल फिस्टुला, you will see the swab staining blue. But in the ureterovaginal fistula, because there is no methylene blue here, the swab only gets wet. The swab only gets wet but not blue. Okay, there is only wetting because there is a fistula. But because there is no methylene blue dye in the ureter, it only gets wet. It does not get stained blue, right? So here they have told you that the middle swab is stained blue. मिडिल मतलब ब्लैडर वाला, मतलब इसका आंसर होगा वसाइको-वजाइनल फिस्टुला. Okay, that's going to be वसाइको-वजाइनल फिस्टुला. And what is the history in uretero-vaginal fistula? Classical history given in ureter-vaginal fistula. तो इसमें क्या होता है? Because of the fistula, there is continuous dribbling which is present, but the other ureter is filling the bladder. And that is why there is normal voiding also present and there is continuous dribbling also present. So both are present in ureterovaginal fistula. Okay, both are present in ureterovaginal fistula. Similar history in a child. What will you think of in that case when you have similar history in a child? Like a child is there who has dribbling plus the child has continuous, there's continuous dribbling and there's normal voiding also. If this is the history in a child, then what do you think of in that case? It is ectopic ureter. Okay, it is one of the ureter is ectopic inserted, like in a case of duplication. है ना, वीगट में ये रूल कि ऊपर वाला यूरेटर एक्टोपिक जाता है एक्टोपिक साइड पे, तो वहां पे भी कंटिन्यूस ड्रिबलिंग होगा पर नॉर्मल यूरेटर की वजह से नॉर्मल वॉइडिंग भी होगा. So in a child that is ectopic ureter, absolutely right, Shri Harishwari, very good Prachi, it is ectopic ureter in that case. Okay. Yeah, so that I think was a very quick session and a short overview of how the tricks, if you are very good with them, you know, you can actually solve the questions very fast, and that helps you to save your time for some difficult questions or some new questions in the exam, right? So that is how the tricks and the mnemonics help you to crack the exam, right? They are actually your game changer and time saving factor in your exam, right? So learn them in such a way, do not keep them for the last कि पहले बाकी सब कर लेते हैं और फिर ये सब पढ़ेंगे. You have to do this complementary to your primary resource so that your retention is very good. Okay, your retention is very good. Okay, yes guys, so that was about today's test. Tomorrow in the Medsynapse app for subscribers, we will have the OBGY test discussion. The test will go live by tomorrow morning and we will have the discussion in the evening. So give the test for all the subscribers, give the test. We will discuss those questions in the tomorrow's test and discussion. There will be around 20 to 25 questions of OBGY that we are going to discuss tomorrow. Okay. Any other queries before we call off for this session? Yes. All right. Thank you so much, everyone. Goodbye. Take care and keep studying, keep revising, keep Medsynapsing and keep winning. I'll see you again soon next week for another free test and discussion with the YouTube live session. Okay? Thank you so much, everyone. The Panshu surgery annotated one has been uploaded. Kindly check that. It's already done. Score of 8 is a good score, right? It's a good score, but definitely the questions are easy ones. So I would say ki, you should target 10 on 10, but if you are at 8, you are still good. खुशी लीवो और डेक्स्ट्रो सिंपल है. लीवो मतलब लेफ्ट और डेक्स्ट्रो मतलब राइट. ठीक है, जैसे डेक्स्ट्रो वर्जन, लीवो वर्जन, दीज आर हॉरिजॉन्टल गेज यहाँ पे जो हो रहा है. डेक्स्ट्रो एलिवेशन मतलब हम राइट साइड में ऊपर देख रहे हैं. लीवो एलिवेशन हम लेफ्ट साइड में ऊपर देख रहे हैं. ठीक है, दैट्स इट. गौरव, आई बिलीव इट माइट बी मोस्टली जनवरी, कंसिडरिंग कि अब तक कुछ अनाउंसमेंट हुआ नहीं है, राइट? बट प्रिपेयर एज इफ इट इज योर डिसम्बर एंड. So that is how you should go about it. Okay. All right. Thank you so much, everyone. Goodbye. Take care.